Gallbladder diseases have become increasingly common these days. In today's video, let's talk about what these diseases are, how we diagnose them, and how we treat them. Hi, I'm Dr. Uday Kiran, laparoscopic and laser surgeon at Sree Nandaka Hospital. There are various types of gallbladder diseases, the most common being gallstones. Gallstones are commonly found in women over the age of 40 years who are slightly premenopausal and in individuals who consume a lot of cholesterol in their diet. The reason being that when there's a lot of cholesterol in your diet, the gallbladder tends to empty much slower, because of which the bile in the gallbladder, which is stored, that comes from the liver, is stored for a very long time. And because of this delayed emptying, it tends to get very thick, and stones and crystals do form in the gallbladder, which later on tend to become even as small as 2 mm, or they can be as big as a golf ball. The second most common type of gallbladder disease is gallbladder inflammation, which can be secondary to gallstones as well. In certain individuals, what happens is the gallbladder itself is hypotonic, that is, it doesn't empty on time. This can also cause delayed emptying of the gallbladder and thereby causing inflammation. Another disorder of the gallbladder is a functional gallbladder disorder, which can be genetic as well, wherein the nerve supply to the gallbladder is hampered congenitally, which causes delayed emptying. Another disorder of the gallbladder is gangrene of the gallbladder, which is fairly late presenting. It is usually seen in patients who have diabetes and other comorbidities, wherein their response to pain becomes reduced. Thereby, patients generally present to us in the last stages of the disease, where the gallbladder itself, the blood supply to the gallbladder becomes reduced, and the gallbladder wall becomes gangrenous, that is, it becomes black and almost comes to a point where it can burst. Another disorder of the gallbladder, which has become increasingly common these days, is gallbladder cancer. Gallbladder cancer, since our diagnostic methods have improved and our visual methods have improved, the gallbladder cancer has become increasingly common because of recent diagnostic methodology, which is able to pick up even the smallest of gallbladder cancers. The precursor to gallbladder cancer is usually gallstones and recurrent infections and inflammations in the gallbladder, which are usually not detected in specific patients, such as ones with increasing comorbidities, such as diabetes and other neurological disorders, and pain is not felt by them. So we usually diagnose these patients very late, and by the time they come to us, usually it is much higher grade. I think this is one of the most common causes for gallbladder cancer is gallstones itself, which cause recurrent attacks of cholecystitis, which is inflammation of the gallbladder, and infection in the gallbladder. Another disorder of the gallbladder, but not particularly related to the gallbladder, is cholangiopathy. It can be a very distressing disorder because it not only attributes to the gallbladder, it attributes to the entire biliary system, which is the liver, the common bile duct, the pancreatic duct, and also the ducts arising from the gallbladder itself. Any obstruction in this entire biliary pathway can cause a reverse flow of the bile, which will cause a lot of pain and distress and fever and other symptoms, which can be very distressing both for the patient as well as the surgeon. Some of the most common tests that we do to diagnose gallbladder disease is a complete blood picture. In the complete blood picture, we can diagnose if you have infection in the gallbladder. Also, your blood levels give us a fairly good idea as to how much of the disease is extensive or is it less extensive. The next common blood test that we do is a liver function test. The liver function tests also give us an idea of the amount of bile in your system, whether it's being excreted in the right way or not. Another test that we do is a pancreas function test, that is an amylase or a lipase. These are common enzymes that are secreted from the pancreas. The analysis of the levels of these enzymes give us a fair idea as to how the pancreas are functioning. Another common scan that is available all throughout, even in the most rural areas, is an abdominal ultrasound. It is one of the cheapest methods to diagnose if you have gallbladder disease. In a good hand, in a more experienced hand, abdominal ultrasound is the test to do to diagnose gallbladder disease. There are several other scans that we can do, something called a Hida scan. There's also another test that is an endoscopic ultrasound. Endoscopic ultrasound and the Hida scan require more expensive equipment, which may not be available or a lot of people may not have access to. A last but a very important test that we do is an ERCP. ERCP refers to an endoscopic retrograde cholangiopancreatogram, which sees the entire biliary tract. It is one of the most important tests that we do in cholangitis. And an ERCP is also an endoscopic procedure. That is, we insert a camera or a light tube through your mouth into the stomach and the intestine, wherein we see stones and we remove them. This test also is a precursor to doing surgery for the gallbladder in some situations where the stones in the gallbladder may have slipped into the lower tract as well. Some of the common questions that we as surgeons get when gallbladder surgery is involved is when and why is gallbladder removal surgery needed? Gallbladder surgery is definitely recommended for patients who have gallstones. There are symptomatic as well as asymptomatic stones. Symptomatic stones definitely need surgery. Asymptomatic stones can be managed to a certain extent. It's just that asymptomatic stones can sometimes become extremely symptomatic in cases where diabetes is co-associated with gallbladder disease because their general pain perception is reduced. If you like the video and if you think the information was helpful, please share this video with your friends and family who might need to know more about gallbladder diseases, and subscribe to the channel so we can keep you updated on more such stuff.